I'm a consultant clinical psychologist, and my day job is head of employee wellbeing for Aneurin Bevan University Health Board, which is in southeast Wales. I also am co-chair of the DCPs Leadership Management Faculty, so a few hats on. We're not going to know about the full impact of this for a long time to come, because I guess if you think about what COVID is, it's not just a disease, it's a kind of social meteorite. It's something that has hit, and yes, there's the clinical aspects, but it's having rippling effects all over, whether it's isolation, whether it's kind of fragmentation of society and social networks. I really think we're going to be watching this for a long time to see what's happened. And here we are on the eve of a second level of lockdown. I'm really quite concerned by how that's going to, I guess, logistically be done, but also what's the impact going to be on people's mental health. So definitely mental health there's a greater awareness of of potential for harm and impact. I think the general public, and actually a lot of people don't really understand what that means. We've talked about a lot of trauma, but what does that really mean? Diagnostic levels versus your small t trauma, where people become more anxious and feeling more vulnerable. It's really hard to understand where it's going, but certainly a greater sense of vulnerability, a greater sense of caution, probably a greater sense of vigilance for threat. None of these are good things, and I think they're definitely here. Again, looking at my world, I'm trying to steer a conversation away from, just fix the individuals as a solution to actually let's create greater stability and safety in people's teams and systems. Can we create peer support networks rather than therapy support? And those conversations are, I think, probably being had in a number of places. But I guess we just have to be really thoughtful how we navigate through this when there's a lot of people kind of screaming for solutions to really complex problems. But I guess the short answer to a very tricky long question is yes, there will be a significant mental health impact. I'm just not sure what it'll look like yet. I'm not sure anybody is.